From the Cronkite studios in downtown Phoenix, this is Cronkite News.
Good evening and welcome to this special edition of Cronkite News on Arizona PBS. I'm Andre Sims. Cronkite News is dedicated to covering issues impacting the health and well-being of all Arizonans. Tonight, some of our top stories ranging from mental health resources, treating addiction, and caring for our state's aging population.
Hitting the trail to help prevent suicides. That's the goal for one local group because September is National Suicide Prevention Awareness Month. Cronkite News reporter Sammy Gieber shows us their prevention effort.
This month brings awareness to the problem that so many face in Arizona alone. A person dies from suicide every 7 hours. I met up with a local group determined to make sure they're taking the right steps to save a life.
You want to get the hike on?
It's a beautiful day for a picture-perfect hike.
Watch this way, but my camera's not working. Sorry, guys.
Or not. Normally, this group is known for their parties with a purpose to raise money and funds for good causes.
Good day to have a good day.
But today, they're getting up off their bar stools.
You okay?
To raise awareness for something that some of their members struggle with.
Today, we are doing a suicide prevention hike because it is an epidemic that needs to stop.
I had my first attempt when I was 16, my second attempt when I was 25, and 2 weeks ago.
Let's look at the bigger picture in Arizona. Every 7 hours, we lose someone to suicide.
And in Maricopa County, suicide rates have gone up. In 2006, about 14 people out of every 100,000 committed suicide. By 2016, that number grew by about 2.
The more that we talk about it, that's how we're going to start decreasing the suicide rates in the state of Arizona.
I feel that it's more than just a hike. You need a follow-up to the hike. This is 8 things to remember when going through tough times.
Oh, that's a good one.
Especially on the way up to the top of the hike, it was really just thinking the way that I do with my depression. Just one more step, one more day, just keep going, and you'll eventually get to where you need to go.
If you or someone you know is having thoughts of suicide, it's important to remember that resources are there. You can go onto afsp.org for more resources or call the National Suicide Prevention Lifeline at 1-800-273-8255. In the Broadcast Center, Sammy Giebers, Cronkite News.
Aside from the physical destruction that hurricanes bring, they can leave behind emotional and psychological damage as well. Reporter Jimmy Jackson looks at how the American Red Cross is helping Hurricane Florence victims cope with the disaster.
This is what was traumatic to me, leaving and knowing the conditions, wondering if I couldn't survive a night, wondering how are they going to survive this.
Lillian Ortiz was vacationing in Puerto Rico when Hurricane Maria struck a year ago. She says the destruction left behind after the hurricane was painful to witness. The American Red Cross's disaster mental health team knows the mental stress Mother Nature can leave behind. Volunteers have been working in North Carolina to help survivors of Hurricane Florence cope.
Our overall job is to be a compassionate presence with folks who have suffered trauma and significant loss.
Durham also mentions how part of disaster recovery is getting people's lives back to the way they were, but understanding that for everyone, that won't always be the case.
Now, the truth is they may get to a new normal. Things may never be the same as what they were. They may not be able to live in the same home.
Life isn't the same for Claudio Medina. He had to relocate to Arizona to live with his daughter after Hurricane Maria destroyed his home.
For me, it's depressing to visit Puerto Rico now. I am looking for some light that bright our horizon and permit us to say, okay, I'm ready to go to Puerto Rico. But at this moment, I don't think so.
Ortiz's advice for people affected by Hurricane Florence is to help each other out.
That's what I can really tell the people, because I know that's what helped the island. You know, that they all just got together and says, no, this is not going to destroy us. We have to rise from this.
The disaster mental health team will be in the areas impacted by Florence for months if necessary. In Phoenix, Jimmy Jackson, Cronkite News.
If you want to help those affected by Hurricane Florence, you can reach out to the American Red Cross.
Pharmacists in Arizona can deny customers certain prescription drugs based on moral and religious beliefs. Cronkite News reporter Cami Clark explains how a recent case shows customers have to know their rights and what to do.
In that moment, I felt very vulnerable and out of control of my body.
Nicole Arteaga had just suffered a miscarriage when a pharmacist at a Walgreens in Peoria refused to fill her prescription. Arizona law allows such refusals, but Arteaga says the pharmacist could have worked harder to help her at the store rather than send her down the road.
He didn't even have to say anything to me except, I'm going to pass you over to this lady here who is, helping somebody else. When she's finished, she'll take care of you. I think a policy like that, and then just, making sure that they follow that.
Attorney Donald Alvarez says customers have to rely on their own awareness of the so-called conscience clause.
I think that it's up to the particular companies that the pharmacists go to work for. I'm sure that they're made aware of the law when they're training and getting their education.
Neither the Arizona State Board of Pharmacy nor the Arizona Pharmacy Association trains pharmacists on how to handle such refusals. The Arizona Pharmacy Association says in a statement that its members have diverse beliefs. AZPA recognizes the individual pharmacist's right to exercise conscientious refusal and also supports the establishment of systems to ensure patients have access to legally prescribed therapy without compromising the pharmacist's right of conscientious refusal. Arteaga says her story can happen to anyone.
I was completely blindsided by this event even happening. So I just wanted to spread awareness so that way other people who might be going to get a prescription filled, that they can be aware that pharmacists actually can say no.
Arteaga's complaint is still under investigation by the Arizona State Board of Pharmacy. In Phoenix, Cami Clark, Cronkite News.
Arizona and at least 5 other states have conscience clauses.
Early detection may be the only hope for the thousands of people expected to be diagnosed with Alzheimer's. As John Cardinelli reports, a doctor in Tucson has found a new way to detect the disease early on.
Arizona has the second highest growth rate of Alzheimer's disease in the country, and those numbers are on the rise, according to the Alzheimer's Association.
Individuals living with Alzheimer's in Arizona right now, 140,000. That number is expected to grow to about 200,000 by 2025.
Although there is no cure for Alzheimer's, it is still very important to detect the disease in its earliest stages. Dr. Danielle Goldfarb believes there is hope when it comes to early detection.
There have just been some studies or some trials that have published data preliminarily that are looking quite good.
Here at the University of Arizona's Department of Psychology, Dr. Matthew Grilly has recently discovered that autobiographical memory tests are effective in catching Alzheimer's early on.
We're really sort of building off several decades of research on autobiographical memory. So this is not a test that we created from scratch. We just saw it as an opportunity to apply it in a new way.
An autobiographical memory test questions one's past experiences. The participants' responses are graded on how vivid the memories were described.
We record them and go back later and take a standard or validated scoring protocol and break the memories down into little details.
Subjects who are cognitively normal participated in the study. However, half of the participants had a gene variant that could lead to Alzheimer's. Grilly found this group's results to be interesting.
They were able to come up with things that happened recently or happened remotely, and they were able to describe them. But when we took a closer look at the memories, we see that they're not describing them with as much detail. They provide a slightly fuzzier picture.
While not a cure, this is a new way to detect the disease in its earliest stages. And if a medication comes out that slows down the disease, it can help families buy memories with their loved ones. In Tucson, John Cardinelli, Cronkite News.
Some doctors are optimistic and believe within the next few years an effective drug will come out to slow down the disease.
Being prepared during an emergency could save a life. A new grant has the Phoenix Fire and Police Departments teaming up to educate the community on how to stop the bleed. Reporter Tanaya Williamson joined them downtown for training.
We all have the ability to help each other. We cannot always just rely on the fire or PD. We have the ability to do it ourselves with this type of training.
In moments of crisis, it is sometimes hard to know what to do.
That's what we're doing here today with Downtown Phoenix Incorporated. We're preparing them for active shooter and mass casualty type incidents. The police department is training them in run, hide, and fight, and the fire department is training them in stop the bleed.
The classes are funded through a complex coordinated terrorist attack grant from FEMA. Stop the Bleed encourages everyday people to step up during life-threatening emergencies.
You can bleed to death in about 5 minutes. So controlling bleeding is all about pressure and compression. A tourniquet is just a way to provide an extreme amount of compression to an area so that you can stop bleeding.
And in that mass casualty situation, police advise, run from the attacker, hide if you can find a safe spot, and fight if it is the last option.
If they don't have a plan, then what tends to happen is people freeze, and that's valuable time that you could have used to help get yourself out of the situation or help survive the situation.
For people like Chris Spale, learning to apply a tourniquet was the biggest takeaway.
We've learned how to both do it to an individual, somebody there, and also to ourselves, the proper way as far as how tight. Also, if somebody's probably going to tell you that hurts or something like that, you still have to do the tight part and get it done properly and stuff like that.
In downtown Phoenix, Tanaya Williamson, Cronkite News.
Classes are available across the state. Go to bleedingcontrol.org to find a class near you.
A new bill is aiming to provide research funding for a disease that rises from the soil. Cronkite News reporter Cami Clark explains how the bill will help Arizona take the next steps in finding a cure for valley fever.
The new legislation would give $40 million to research for valley fever vaccine. But the vaccine may come for your pet before it is available to you. Congressman David Schweikert says that the Forward Act of 2018 could advance research in valley fever if passes Congress.
It creates a focus and resources to actually take on valley fever for those of us here in Arizona. But the second thing, it also has this really interesting technology of how we capture data to actually head towards building that vaccine and new drug treatments.
Schweikert says Arizona and other states could receive $40 million in matching funds over 5 years for research into fungal diseases like valley fever. Another $5 million could be authorized to establish a blockchain pilot program to enable clinical research for valley fever.
It's this orphan disease that much of the rest of the country has never heard of, doesn't care about. And one of my personal passions is I am going to, through at least my position in Congress, find the resources to fund the research to see that we get a cure.
But canines will likely get a vaccine before humans.
Well, we are trying to get this vaccine approved through the USDA to help dogs. And I think there won't be a human vaccine until we accomplish that.
Schweikert says he and other members of Congress are still fighting to fund the valley fever battle.
Part of the goal of doing that was what resources were necessary, how do we make sure that the National Science Foundation and others have valley fever as one of their priorities, and then how do we use the legislative process to get the resources and access to the information to head towards that cure.
Schweikert hopes to present the bill to the House by the end of this year. Experts estimate a vaccine for dogs can come as soon as 4 years, but there is no set time frame for people. In the Broadcast Center, Cami Clark, Cronkite News.
The opioid antidote Narcan can treat narcotic overdose in an emergency situation, which just might save a life. Cronkite News reporter Holly Bernstein went to the Celebrate the Art of Recovery Expo to find out how Valley residents can get access to a Narcan kit for free.
For me, I was very fortunate to have phenomenal parents.
Justin Luke Riley has been in long-term recovery from alcohol and drug abuse since November of 2007. This past weekend, the Celebrate the Art of Recovery Expo offered resources to Valley residents seeking recovery from all forms of addiction. The harm reduction organization Sonoran Prevention Works offers free Narcan and explained how to use it at the expo.
What you're going to do if you think someone is overdosing is you take your knuckles like this, you put it in a fist like that, and you're going to want to rub their sternum very vigorously.
If they do not respond, that means the person is overdosing.
You take one of the doses of Narcan out, you pop the orange cap off, you stick the needle in there, you suck up the whole dose. And this is intermuscular. It's pretty much, it's designed to go somewhere where there's a little bit of meat, a little bit of muscle, so you want to stick it here.
Ryuta explains that you should give the recipient the entire dose, and if they do not respond within the first 2 minutes, you should give them the second dose. Riley says events like the Celebrate the Art of Recovery Expo are important because it shows people that there is hope, and people seeking recovery should not be afraid to get help.
I think my advice for people in or seeking recovery would really fall in line with doing a quick assessment of saying, if I'm trying to stop behaviors and I can't do that on my own, maybe I should get some more help.
In Phoenix, Holly Bernstein, Cronkite News.
Ryuta says you can contact Sonoran Prevention Works if you are interested in getting a free Narcan kit. Valley residents can also get access to Narcan through CVS Pharmacy.
Tempe firefighters are stepping into the dark to learn more about Alzheimer's and other forms of dementia. Cami Clark shows us how firefighters involve themselves in the world of patients to improve medical treatment.
Tempe firefighters are learning what it's like to be disoriented, like someone with dementia. Paramedic Gretchen Chalmers wears shaded glasses, a headset, and heavy gloves to muffle her ability to hear, see, and touch.
You're hearing things going on and your vision's not the same, and obviously your grip's not the same, and so to do these things was a lot harder.
Tempe is considered a dementia-friendly city. Special projects consultant Jan Doherty says that dementia is expected to increase 50% over the next decade.
It's becoming increasingly important for cities to learn about its citizens who are often forgotten about, which are people living with dementia.
Paramedic Corey Wiggum says that handling someone with dementia is different than other emergency calls.
The patience and taking our time and making sure the patient understands what's going on and know that we have to be, say, just short sentences and make sure that we we can't just rattle off a bunch of questions, but just trying to get to the root of the problem.
For Gretchen Chalmers, the training is personal.
I had a grandmother that had dementia and Alzheimer's and ended up passing away, but in the end it was really, really difficult.
Nearly 200 firefighters have been trained in dementia awareness since July. In Tempe, Cami Clark, Cronkite News.
The city of Tempe is planning to expand dementia training to all employees in Tempe, according to their website.
One man's complex medical condition reveals a trend toward personalized care. Reporter Charisma Sandoval explains how one-size-fits-all prescriptions are giving way to treating patients as individuals.
Remy Marceau's case was rare. Doctor after doctor thought he couldn't do outdoor activities because low potassium made him dehydrated. It wasn't until he was 19 years old that he found out he had a rare kidney disorder called Bartter syndrome.
Syndrome progressively got worse at a rate that they had really never seen. And by the time I was 22, I was doing an infusion every day for 8 hours to replace my electrolytes and all of my fluids.
His diagnosis led to a unique result. Both of his kidneys were removed and 2 transplants were performed. He says all his doctors, pharmacists, and dietitian worked together to give him a personalized treatment plan that would help him return to the life he once lived.
Getting back to being outside, being active, working out, and doing all those things that a normal person would do, that's what I've looked forward to the most.
And doctors are saying the want for customized care is only going to grow.
We really try to look at each patient as a unique person, and we look at not only the science in terms of the clinical aspects of their care, but also looking at their mind, their body, their spirit, looking at their relationships in their life, looking at the broader context of who they are and taking a holistic picture.
According to Dr. Paul Andrews of the Mayo Clinic in Phoenix, tech-savvy patients are becoming more educated about their conditions before they reach out for medical treatment.
A lot of the people who are coming in now are very sophisticated about what's going on in their health, especially the younger they are and they grew up in the digital world.
Remy Marceau says medical care shaped to his needs made all the difference in his health, and he's on his way to recovery.
When you have that customized care, especially in a complex health situation where it's not just your typical flu that you get once a year, it makes a huge difference as far as communication, treatment, and just outcome.
In Phoenix, Charisma Sandoval, Cronkite News.
Several hospitals have expanded their facilities in recent years. The Mayo Clinic plans to nearly double the size of its Phoenix campus over the next 5 years.
Suicide may not be openly discussed, and those helping people through their struggles may be struggling themselves. Cami Clark explains how mental health professionals feel the pain of their patients' suicides.
Suicide can affect those closest to the person lost, but mental health professionals are also impacted by the suicide of their patients. Psychologist Lisa Fisher explains the emotional toll that those in her field may experience.
They become very guilt and feel very ashamed, and they feel alone, not comfortable to talk about it.
As mental health professionals feel the effects of their patient's suicide, psychiatrist Brian Espinoza explains how he checks on colleagues who may be struggling.
Well, I do have a couple of physicians that I'm kind of concerned about, and occasionally I'll reach out to them, whether it's in the hallway in the hospital or give them a text and just remind them that I'm always available to talk with.
According to the Center of Violence Prevention and Community Safety at Arizona State University, in 2016, about 56% of people who died by suicide in Arizona had at least one mental health problem. Impact Suicide Prevention Crisis Call Center Manager Dennis Therian says professionals who provide help also go through the grieving process.
If there's not that awareness and people think because of maybe their status or professional position, they're not affected in the same way, they never get the help that they need, and they're exposed to it more than most. So it's really important to acknowledge that, so that opens the possibility to getting that help.
While psychologists and other mental health care professionals feel the effects of suicide, psychologist Lisa Fisher has a support group where others can come and cope.
Our job is to take care of other people, but we tend to forget to take care of ourselves. So when something very traumatic like suicide happens, we need to take care of ourselves as well.
Regardless of your profession, Fisher says it's important to communicate your feelings and to reach out for help. In Phoenix, Cami Clark, Cronkite News.
According to Psychiatric News, one doctor dies by suicide every day in the U.S. A rare disease similar to polio has now affected at least 8 children in Arizona. Cronkite News reporter Samantha Lomibao spoke to one boy about his diagnosis and treatment.
The day that it happened, he woke up normal.
10-year-old Talon Spitzer went to school, even though he had a shoulder and chest pain, came home, and that night, Rochelle Spitzer asked Talon to get ready for bed and to bring his dirty clothes upstairs.
I was scared. I didn't know what was going on.
And that's when he realized that, that he couldn't pick up his hamper. It was that quick.
In just a matter of minutes, Talon went from his nightly routine to being rushed to the hospital.
And I was sitting in there in the ER room demanding that I'm not taking my son home with his hands paralyzed.
And I couldn't open my hands anymore. At first I thought it was like a joke, I was kind of laughing and stuff. And then I realized it was serious. And that's when it got really scary, and then I just couldn't control anything anymore.
It took doctors several months to diagnose Talon with acute flaccid myelitis. While they were trying to determine what caused the paralysis, Talon underwent weeks of physical therapy to try to regain movement.
When Talon first came in, there were multiple issues that we had to address. Weakness. He had a lot of weakness in his lower extremities, a lot of weakness in his upper extremities.
He's went from not walking. We didn't know if he would, and he couldn't use his hands at all, and he's slowly, over 2 years, regained that, but it doesn't come easily.
And simple things like tying a shoe are all things Talon had to relearn.
Has a hammer in his hand, and we're just working on strengthening his wrist motions. Something that you and I would take for granted, opening a doorknob.
Talon has now recovered enough to play one of his favorite sports.
He had to go through a lot of therapy to even be able to walk again, and then it was starting to build up the endurance and stuff, and then kind of moving into running from there. This has been his 3rd season now that he's been playing rec soccer again.
Although he is on the road to recovery, there's still more work ahead on his journey.
I just look at something that I can't do right now and I say, I just want to do that, and so I work towards it until I can do it.
According to the Centers for Disease Control and Prevention, AFM may be caused by viruses and environmental toxins, with most cases being found in children. In the Broadcast Center, Samantha Lomibao, Cronkite News.
Faith leaders across Arizona now know how to use the life-saving opioid overdose reversal medication. Today, I attended a training focused on administering Narcan to help those battling addiction.
Dozens of faith leaders from all over Arizona decided to take action against the opioid epidemic.
So much needs to be done for young people before drugs become the answer.
The Attorney General's office held a training about Narcan to help combat overdoses.
All the medication is from here to here. It goes intranasal. So you just set it maybe about that much into the nasal cavity and then push.
According to the Arizona Department of Health Services, there have been more than 14,000 opioid overdoses over the past 15 months in Arizona alone. Clergy member Kim Sterner says her son Jonathan died of an opioid overdose in 2016.
He was in the ER and his dealer came into the ER and Jonathan shot up while he was in the hospital. He was on life support for 4 days and then we finally just took him off. It ended up being his birthday.
Fred Taylor from the Attorney General's office says this training can save lives.
There are going to be cases and times when somebody might OD in church, or they're going to OD in and around the church. So we're equipping people for the future.
The Attorney General's office has trained more than 300 members of law enforcement on how to administer Narcan so far.
That's it for Cronkite News tonight. Thanks for joining us. For top Arizona stories anytime, go to cronkitenews.azpbs.org.